Hey everyone, I'm Anastasia. This is Coffee Chat with Anastasia. My guest today is Dr. Leanne Brady. She is here at the Hinman in Atlanta, all the way from Phoenix, Arizona. Dr. Brady, thank you for joining me today.
Oh, my pleasure. Thanks for having me.
What are you drinking today?
I am having a decaf mocha because too much caffeine is not good for me.
It's not. And you actually have two different varnishes in your office, which makes it very different. So can you tell me about that?
I can. You know, my actual practice is an adult restorative practice, so I see very few children. Probably about 80-85% of our patients get a varnish of some kind when they're in for their hygiene visits. And so we really use it in two ways. If we have a patient who has high caries risk,
yes,
and we do want to get them on fluoride, because fluoride is one of the first lines of defense, we'll really strive to say, can we get them using something high fluoride at home? Then when they're in our office, we can actually do another mechanism of action, which is part of the Camber protocol, which is chlorhexidine.
Right.
You know, having a patient do a chlorhexidine rinse,
yes,
7 days on, 20 some days off, and then remember, not super great at getting patients to do that.
And people don't care about disease, they just want their stain off.
Exactly.
Yes.
So yeah, when I found out about Cervatec Plus, which is the chlorhexidine varnish, which doesn't taste bad, doesn't cause any staining, doesn't affect your taste buds, I can now go at their caries risk two ways. I can strengthen the teeth with high fluoride at home, and I can kill off the microbes by doing chlorhexidine varnish in the office.
So when you're doing, and obviously this is made by Ivoclar, so we got Cervatec Plus. My question would be for people who haven't used this, what results do you see post scaling and root planing, and what is the compliance level for the patient?
Oh, you know, the thing about Cervatec that's phenomenal is it isn't a compliance issue, because we get to do it in our office. So I'm not sending them home with something else that they have to put on their counter in their bathroom and remember to do, or go to a drugstore and remember to get filled. So that part of it for me is really easy. You know, what we do with it when we do scaling and replaning is we actually will get them on a chlorhexidine rinse while we're actively scaling and replaning, because it does have a little different mechanism of action. But as soon as we can get them off of the chlorhexidine rinse, and we're going to do that polish of their teeth and get the stain off at the end of scaling and replaning, we'll then apply Cervatec Plus at that appointment. Because really, when we look at the science behind it, it is going to help us keep the microbe count down for about 90 days, and we're going to have those folks on 3-month recalls.
What about the Fluor Protector S? So where do you use that in your office?
You know, when we have patients who have high caries risk, again, fluoride is my first line of defense. It's a highly aesthetic, really non-obtrusive fluoride varnish, so we get way fewer of those complaints from our patients.
These are two great products. I've never thought about it as a hygienist to think, oh, I should have another option for people, especially with perio, 80% of the population. It's amazing. So thank you for carrying these two and educating your team to help everybody else in the practice take what they learn and make a difference with it. Thank you for joining us.
My pleasure.